7th. It's about 10:45 in the a.m. Just one comment first with regard to the Senate Health Committee analysis. It shows an amendment on April 6th. That should be corrected to April 7th of 2011 with a hearing date of April 7th, 2011. The amendments were to add an urgency to it. The author is Steinberg, and the Senate bill number is Senate Bill number 90. Senator Steinberg, good morning, welcome, and please present.
Good morning to you, Mr. Chairman. Just a few minutes ago, the Senate passed Assemblymember Monning's bill, which is the quality assurance fee for fiscal year 11-12. This is the counterpart that would provide the similar fee for the period of January 1 of this year, 2011, through the end of the fiscal year, June the 30th. The state, of course, participating in this, and I'm authoring this bill because of its positive impact, in part on our state general fund, to the tune of about $500 million. The part of the bill that might be considered somewhat controversial is the issue of the seismic safety regulations. And I myself have grappled with this issue, and there were various proposals floated, including a blanket 7-year extension of the 2013 deadline, which, as the author and as the Senate leader, I felt was not the appropriate way to go. Instead, in negotiations with the Hospital Association and with the administration, we arrived at a solution which I think is fair and appropriate, recognizing California's risk of earthquake and the financial plight of hospitals. Essentially, what we say is that on a case-by-case basis, that OSHPD, and the OSHPD director is here and will testify in a moment, that OSHPD will have the task of balancing, on a case-by-case basis, the structural integrity of the hospital building, not some subjective evaluation, but the HACCIS evaluation method, which is the most refined method of, if I'm pronouncing that right, the most refined method of determining the structural risk of a hospital from earthquake, to balance that risk with community access if the hospital building were to close, the financial capacity of the hospital to complete the construction project. I believe this is fair and reasonable. OSHPD would have the discretion to grant an extension for up to the 7-year period, would also have the discretion and, frankly, the responsibility to deny the extension if it believed that the structural integrity of the hospital building was such that it would be too great of a risk to allow for the extension. And, of course, OSHPD could decide an intermediate solution by granting an extension for less than the 7-year period. I'd urge an aye vote on what I hope and I believe is a balanced measure.
Before we proceed, I'd like to go ahead and establish a quorum. Secretary, call the roll.
Senator Hernandez.
Here.
Strickland.
Here.
Alquist.
Here.
Anderson.
Here.
Blakesley.
Here.
De Leon.
Here.
DeSaulnier.
Here.
Rubio.
Here.
Wolk.
A quorum has been established. Please proceed.
Well, good morning, Mr. Chairman, committee members. I'm David Carlisle, OSHPD Director, and with me is Paul Coleman, Deputy Director of our Facilities Division. And we have been working with the author's office and the sponsors on this bill and are here to support the measure and are here to also provide answers to any technical questions that you might have of us. Thank you very much.
Is there anyone else who'd like to speak in support of the bill? Please state your name and your position.
Thank you. Ann McLeod from California Hospital Association, Senior Vice President for Health Policy, and CHA is the sponsor of SB 90. SB 90, authored by Senator Steinberg, is part of a two-bill package, an important two-bill package that, again, includes a 6-month extension to the very successful hospital fee program that just concluded and brought more than $2.6 billion in federal funds to California hospitals and provided more than $500 $560 million in funding for children's health care coverage. The package also includes a comprehensive budget solution that achieves hundreds of millions of dollars in general fund savings for the state, while ensuring that the maximum amount of funding is available for hospitals to provide medically necessary patient care at a time when the unemployment rates remain stubbornly high in California, and many Californians don't have job-based coverage, and they seek emergency medically necessary care in the hospitals. On behalf of more than 400 hospitals and health systems in California, we respectfully request your support on this.
Thank you very much. Is there anyone else like to speak in support of the measure? Please state your name and your position.
Hi, Sarah Nichols on behalf of SEIU California, in a very strong support of the measure. Thank you, Mr. Chair and members. We think this is a crucial part of the hospital financing, children's health care financing. Keeping hospitals running and open is vital to our membership. And, of course, we're very concerned about worker safety, and we think that this bill, this package, appropriately balances concerns for worker safety. Thank you.
Okay, thank you. Anyone else who would like to speak in support of the measure? Okay, is there anyone in opposition?
Give up your seats here if you would, please. Thank you. Hey, you.
How are you?
Good. How are you? Nice to see you.
Good morning. Please state your name and your position. Thank you.
Mr. Chair, members of the committee, Stephanie Roberson on behalf of the California Nurses Association. Unfortunately, we're here to strongly oppose this measure, and I know that there's a lot of work that has been done on this issue. We, quite frankly, do appreciate you bringing us to the table today. We love Senator Steinberg, but we don't like this bill, and I just got to be quite honest about that. I'll be quite frank. About a month ago, before Japan hit, we were in serious conversations with members in the other house about how we take a focused approach to this issue. We were thankful to be a part of a stakeholders process that we thought was going to move forward as we looked at this very issue of seismic safety, and we were happy about that. We also heard that there was a budget play on this very issue before the Japan situation hit, and then Japan hit, and that whole thing was off the table. And now a couple weeks later, we're back again without a stakeholders process, without enough time to thoroughly vet issues, and we just can't sit here before you and suggest that you vote on a measure that's been rushed through the process. And I'm sure you all know, if you don't know, Japan just had another earthquake this morning to the tune of 7.8, I believe, and we're passing this again. So, and it's not just Japan, it's Haiti. If you remember, it's Northridge, and it was Sylmar before that, right in our own backyard. So we really need to take a look at how we balance budget solutions basically on the backs of the people that we're trying to support. And I understand that a lot of this general fund money may go to children's health care, but it's the children and it's the patients and the workers that are going to be in those same facilities when a next seismic event hits. And it's going to happen. And so what we're asking right now is to separate the policies. We've passed a hospital fee. We've passed a hospital fee without the seismic extension before. We could do it again if it is good faith by folks on the other side to make sure that this budget gap gets closed. So unfortunately, we're opposed. There's a couple other things. We don't think that the language right now precludes hospitals that are already on track to jump back and get another extension. So that unfortunately, puts folks that are that have been complying with the law to disobey the law again. And if you look at the Ducheney bill, last year, I believe even Arnold Schwarzenegger vetoed the message because he felt that he was putting the folks, the good actors that operated these hospitals at a disadvantage opposed to those that were getting the extensions. And that's what we're doing here. We don't know that it precludes extensions in the future. What are the real consequences for actual seismic compliance? We don't see that. We hear that hospitals will close. Well, I think it was either OSHPD or the Hospital Association yesterday testified that that happens voluntarily. And so we just ask that you just take a careful look at these issues as you move forward, and we oppose this bill. Thank you.
Thank you very much. Is there anyone else like to speak in opposition to the measure? Do we have any questions from any of the members?
I have one.
Yes, Senator.
For the OSHPD representative, if that's okay.
I'm sorry to make you come up. I just have one quick question. It's within your authority, correct? You don't hand out these waivers easily. You have to go through and see the hospitals, making sure that the ones that are in trouble situation, you wouldn't do that. But you do provide extensions based on your criteria. Is that correct?
Yes, we have multiple current extension mechanisms, and in the case of this bill, we will apply the three criteria that you heard Senator Steinberg mention via regulations to determine whether an extension is warranted and for how long.
So your testimony here today is you don't hand out these extensions willy-nilly. You go through those criteria, and then if they meet those criteria, then and only then will you hand these extensions out.
We will apply these with all due rigor to make sure that they are appropriately applied.
Thank you.
Senator Strickland, may I add to that? Just because I think it is important. Any administrative agency like OSHPD has the duty to exercise their discretion reasonably. If in a given case they were not to exercise their discretion reasonably, a private citizen could take that question up, I believe, with a court of law.
Thank you, Mr. Leader.
Thank you.
Yes, Senator.
I will be supporting the bill. I just want to ask a question. I've spent a lot of time with OSHPD on this issue over many years, and I think using the HASIS model is a very good thing to do. My question really is on the length of the extension. How are you really going to determine how long that will be? Because it can truly make a difference if it ends up being 3 years versus 7 years, as an example, if there's an earthquake in the fourth year.
Thank you, Chairman and Senators. The bill provides for three criteria to be used in not only determining whether an extension is granted, but also the length of that extension. And I might point out that previous law has allowed extensions on just the community access factor alone or just financial capability alone without consideration of safety of the building, the seismic safety of the building. This one actually brings into balance by bringing that into the mix now that has been missing. So we would look at the building with regards to its seismic safety as one of the major components as well. And if a building is at a very high risk of collapse probability, then we will work with that hospital to find possible alternative solutions that can get them into a compliant condition much sooner instead of later. The bill does allow us the authority to determine the length of that extension, and we can base that on the building safety.
And I believe my last question, unless something else pops up in your answer, is that do you believe you have the resources to do this in a timely fashion so we really understand the conditions of the hospitals and the assessment piece?
We have evaluated that, and based on the number of applications that we expect to receive and the various resources available to the office, we believe we can do that in the time frame.
So we're really talking, what, about 49 hospitals? How many is it now?
There's 49 hospitals that we have forecasted that would, under current law, would have to be closed down on January the 1st, 2013. There are currently 445 SBC1 buildings that have not gone through a HASIS assessment.
Okay, thank you very much.
Mm-hmm.
Is there any other questions from any of the members? Go ahead.
I'm just trying to, maybe you could repeat those statistics for me and help me better understand what the status is of our efforts to achieve these retrofit or seismic safety standards. And you mentioned the three criteria, specifically one of them being a BBB credit rating or below. I think that was the state's credit rating recently. Trying to find out how many hospitals are potentially captured in this sort of list of potential exclusions, and if not, by number, percentage, some basic sense of what we're voting on here.
Well, we cannot actually forecast the exact number today because currently the hospitals have not been required to provide us that information with regards to their credit rating. So this will be new information that will be required as part of this bill. There are currently approximately 220 hospitals that have SBC1 or collapse hazard buildings on their campus that this bill would potentially target. And Does that answer the question? I'm not sure if out of about 437. About half, yes, sir.
Senator Wolk?
I just have a question about the process. Clearly, you distinguish among the hospitals due to their building condition, clearly. Do you distinguish among hospitals depending on the seismic activity in the region?
Yes, ma'am. The HAZAS score that was mentioned previously actually is a program that was developed by FEMA, the federal government, that we have adapted to the application of hospitals here in California to determine a probability of collapse of the building. And it factors in the seismicity of the location, which has to do with the potential ground motion and the type of soil at the location, which can also affect the seismicity. It also factors in the vintage of the building, the year it was constructed, the codes under which it was constructed, the type of construction, and the quality of the construction. So in some cases, for example, in order to ascertain quality, the hospital will actually have to undergo a testing program of the concrete and the reinforcement bars in the building to determine that they are adequate quality to withstand the forces that would be seen at that location.
So when you receive applications for the 7-year extension, the ones that are at the top of that list automatically go to the top of the 7-year extension list for consideration? Or not?
The office will be working with our Hospital Building Safety Board, which is a public body comprised of many individuals from the industry, in developing regulations to define what scores, what probability of collapse scores are placing Californians at more risk and therefore should not be considered for a longer extension. Okay. And we will develop criteria and regulations to define that.
Thanks.
Thank you. Go ahead, Senator.
I was going to say that this represents a really fundamental shift in the law in terms of the way we've dealt with seismic safety, because over the years, what the legislature has done, not right or wrong, has set really rather arbitrary dates, and for good reason. I mean, to say, hey, get this work done by a certain date. But as the gentleman stated, there have never been the consideration of the qualitative factors on a case-by-case basis as now this bill represents. Because what would happen as we approach 2013, I fear, without this change, is that members who represent various districts concerned about the closure of respective hospitals will come forward and we'll have an onslaught of bills saying, well, this should be an exception because this will be the impact on patient care. And then we'll try to, as legislators, ask the question about seismic risk without the background or the experience really to be able to make those judgments. And it ought to be sort of out of the political sphere here, as long as we set the criteria in a way that establish that public safety is first. And can we get you on the record here that public safety is first when it comes to looking at these criteria?
It is absolutely the foremost consideration.
Thank you.
What is?
Public safety.
That's a better framework with which to make the law than setting a date.
Okay, is there any other questions from any of the members at this time? Yes. We have a motion by Senator Alquist, but we still have some additional questions. Please proceed.
I wanted to compliment the author. The idea of having qualitative factors, I think, is fantastic. I wish we could take this concept and apply it to CEQA and other environmental laws to look at the other things.
You had me at hello here.
But I do like it. I do have a concern, though. Part of the bill address future spending in a bill to come. And I'd like to get there on this bill, but without seeing that other bill and how the money's going to be applied, I can't get there because I haven't seen the other bill. But and I just want to, I don't think you're going to need my vote today, but that's how you'd get me up, is if I knew how the rest of it was going to turn out. So thank you.
Maybe we can. 90 minutes.
Sure. Thank you for your question. The hospitals really came together in forming the hospital fee program, and California Hospital Association has taken the position, and the board has approved a very large work group that we work with of 80 folks representing all the hospitals across the state to come up with a formulaic approach, very similar to what we've been doing. And the hospitals have really taken an all for one and all one for all approach in moving forward with a hospital fee program. And we're very confident through the good experience that we've had already over the last 3 years now trying to do this and get this in motion, that we will be able to have something that the CHA board will approve hopefully within the next 6 to 8 weeks, and we will get that other bill on target and moving so that everybody will have the opportunity to see what that looks like. We don't know what it looks like right now. We've done some very high-level modeling, but we're very confident it will look very similar to what we've been doing in the past, again with the commitment for $320 million in fiscal year 11-12 for children's coverage.
Thank you.
You're welcome.
Okay, is there any other questions or comments from any of the members? I'd like to just make a couple comments. I did have some questions, but most of them were answered with by the questions that the members had opposed. But, you know, I also, as Senator Steinberg mentioned earlier, have some concerns with regard to the seismic safety issue. Him and I both spoke about it, and you know, he came up with this issue and this method of how we were going to be able to address it. So therefore, obviously, I'm much more comfortable. However, I want to just kind of follow up on what Senator Ahlquist said with regard to resources to be able to get this done in a timely manner. With regard, my biggest concern, obviously, is that OSHPD currently has a backlog of construction projects that has grown from $13.8 billion to about $22.7. And the principal reason for the backlog is that employees have been subject to the hiring freeze, furloughs, and some overtime restrictions. If we want to give hospitals a chance to comply with most of these recent extensions, I believe we ought to give OSHPD the tools to meet these demands. And I think we really need to look at either reaching out to the administration. I can be more than happy to work with you to lift some of those furloughs so that we can get some of this work done. Because not only do we have the normal stuff that's going to be occurring with the construction, but we're going to also have this additional workload coming through. And in order for it to become effective and get it out there, we need to lift those furloughs. So that's just kind of a comment I'd like to make. So if I don't see any other questions or any other comments, we have a motion by Senator Ahlquist. We have a return the bill to the floor with a recommendation that the Assembly amendments be concurred in. I'd ask that the Secretary call the roll.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland?
Aye.
Strickland, aye. Ahlquist?
Aye.
Ahlquist, aye. Anderson? Blakesley?
No.
Blakesley, no. De Leon?
Aye.
De Leon, aye. Desaulnier?
Aye.
Desaulnier, aye. Rubio?
Aye.
Rubio, aye. Wolk? Wolk, aye.
Anderson, no.
Anderson, no. Okay, so we've got two.
The measure is 7 ayes and 2 noes. The measure passes. Thank you, Senator Steinberg.